Hello, everyone. Welcome to our afternoon breakout session. Welcome to the Indiana Healthy Community collaborating to improve the well-being of Kosciusko County Breakout. I'm Antonia Sawyer, and I will be your moderator this afternoon. I would like to introduce our speakers for this session, and you can read more about them in the detailed agenda that was emailed to you earlier today. We have Ms. Lisa Harman. She is the president and CEO of Live Well Kosciusko County. I can usually say it, but I can never spell it, Lisa. Spelled out for me today. And Mr. Robert Parker, who is the president and CEO of Kosciusko Chamber of Commerce. This is a panel discussion, so as questions arise, please do pop them in the chat. And Lisa, if you would like any help moderating the questions, please let me know, and I'll be happy to facilitate. So without further ado, please do take it away.
Well, I'm going to get started. So thanks, Antonia. I appreciate it. Thanks for inviting us. And Lisa, I'm going to turn over to you shortly, but if you're okay, I'll just give a high level of how we got started in Kosciusko County. So really, when I came on board at the chamber, one of the things I really wanted to drive was how can we create a different culture within Kosciusko County for healthy living and a healthy environment to attract and retain talent. We've had an issue, as many other communities have across Indiana, of attracting talent. And I believe when we have a healthy workforce, it attracts other healthy workforces and other healthy activities. So the greatest partner I can have in doing this is the K21 Health Foundation. And their mission really is, they exist for the benefit of Kosciusko County residents, to ensure healthcare services are provided and to advance prevention and healthy living. This is accomplished by identifying health needs in our community and maintaining an endowment so funding is provided through investments, grants for those in need. So the chamber partnered with K21 and then also with Lisa from Live Well Kosciusko and said, what can we do to help change the mindset? What can we do to help improve our culture around healthy living? And, we all believe that coming together, this would be our key catalyst for driving change in our community. So we had to have a framework for that, and we selected the Gallup Wellbeing Index, the Gallup Wellbeing Survey, as a baseline for where are we now and where do we want to go. And so with that, we had to have teams, we had to have committees, and I'm going to let Lisa take it from there to introduce the committees and the leads of each one of those committees. So thank you for having me. And Lisa, it's all yours now.
All right. Okay. Thank you, Rob. So we actually made the decision to structure working committees for each pillar of well-being. So the Gallup survey actually surveys community members around 5 pillars. Those pillars are social well-being, physical well-being, financial well-being, community well-being, and career purpose well-being. So after we decided to do that, we thought that it was important to have co-chairs for each of those committees. So we would have folks that would lead the committee, and in case someone had to step off, it would ensure kind of continuity of leadership. So there's lots of decision making before you even get to start. So then we talked about what did we want to do as far as the model of our committee is. I know lots of people have had experiences where they've served on committees and not a lot gets done, or they've served on committees and there have been 1 or 2 people who have kind of done a lot of the work, and it's a lot of information sharing, which there's a need for information sharing coalitions. However, we wanted to actually do a little bit more than that. All right, and so I'm just going to say really quickly, if you hear a child in the background, this is one of those pivots because of COVID. My grandson's preschool is closed until next Monday because they had some positive COVID tests there with the kids. So you might hear him in the background. I tried to bribe him with M&Ms, but So anyway, so then we had to decide on a model for our committee work. And so this is where being, a member of statewide committees came in very was very helpful because Antonia actually introduced me to strategic doing at one of our Hoosier Health and Wellness Alliance meetings. And they actually even had some introductory information. And so took a look at that, and it seemed perfect for what we wanted to do. It was structured for, loose networks where you don't have someone who's, able to tell everyone what to do. It was structured for people who have, complex problems. So it's not, oh, here's a simple solution and this is what, we can do to fix it. And so it was a really good pick. So then we decided that we used that structure. So the co-chairs actually met and they came up with what's called an appreciative question. And so as an example, the appreciative question for our social well-being committee was, what if everyone in Kosciusko County felt a sense of belonging? What would that look like? So then our committees met, and the first meeting was actually a pretty long meeting. Some of them went 3 hours, and a couple of them went a little longer. It just depended on how much time people enjoyed what we were doing. But then, so after that initial meeting, and we also actually reviewed the Gallup survey data during that meeting, and that also helped us focus in on what we wanted to do. And so then, our committees actually each selected a short-term project and created goalposts to see where that project was going. And yes, and so how we would be able to measure what kind of progress we made towards those goals. And then I will say, we actually have had to pivot a couple times because of COVID. For example, our first COVID-related decision involved the timeframe in which we actually conducted the survey. It was scheduled for March of 2020. And of course, we made the decision to delay that. We've switched back and forth from virtual, in-person, and hybrid committee meetings. And then this month, we actually rescheduled several in-person meetings because the COVID cases were going up in our community. And so while that's disappointing, we wanted to make sure that we're being safe and keeping our community well. So now for the good stuff, we're gonna talk to some of our committee members. And so I think first we're going to talk to Devendra, who serves on our social well-being committee. Devendra, would you like to introduce yourself?
Yes, hi. Yeah, so this is Devendra Gorhe. I work at Zimmer Biomed, one of the medical device companies in Warsaw. I've been living in Kosciusko County or Warsaw for the last 15 years. And very happy to be part of this committee and work with Lisa on all the initiatives that has been going on within our county. Thank you.
Great. So Devendra, can you tell us a little bit about why you said yes to working on the initiative?
Yeah, I mean, I think it was a very straightforward for me, because I've been part of this community for last 15 years, as I said. I'm raising my young family in Warsaw. When I came to Warsaw, I was a single guy. I got married and now I have kids, and this community has been like a home to me now. This is my second home. This is the town where I have lived the second most time than my own, like my hometown where I was born and brought up back in India. And so there is always like a special connection, with Warsaw. And my kids go to YMCA here, like all they participate in the local activities. The community, the Indian community in Warsaw has been growing for last several years. And as Rob mentioned, like the retaining and attracting the talent was a challenge in this Kosciusko County or in this Warsaw area. And so when we became part of this community, it was always like, we have got so much from this community, the safety, the security, so many good friends over the years. And so it was always like, like, how do I give it back? How do I give it back to this community, which has given me so much? And so whenever the opportunity comes, I always say yes. And so there was, before, even before the Live Well Kosciusko, there was another organization, nonprofit, called OrthoWorks. I don't know, many of you probably know it. They also had like a diversity committee, and so I used to serve on that committee and do some initiatives, spreading the awareness, diversity and inclusion. And so when Lisa approached, there was no hesitation on my part to become a part of this committee and align with the vision they have, both Rob and Lisa had for this community. So yeah, that's my short, I guess, a long answer.
That's great. So what do you hope is the outcome of your involvement in the initiative?
I think, in that first meeting we talked about, like, how do we give it back to the community, right? Spread the awareness. And so as the theme is like social well-being of this committee, we thought like, okay, there were like, sports is it's such a nice thing, like Indiana is I'm sure, all the states in the US are very focused on different sports, but Indiana in particular, like basketball, baseball, pretty popular, right? And so we wanted to do something different, something new, and so uh, if like people, especially from India, they are very passionate about another sports called cricket. It's like similar to like baseball. I don't know how many of you know or have seen the sports called cricket. It's one of the fastest growing sports in the US as well. There are like a lot of like minor leagues, major leagues are coming up, and all these big cities, they have their own leagues. And so 15 years back, when we started this Warsaw Warriors, we call our cricket team as Warsaw Warriors. And that's what we started like 15 years ago. And then now it has become such a huge thing, like a lot of new people that came to Warsaw have taken it to the next level. They go to like not only different like cities within Indiana, but they go to like within different states like Texas, Florida, to play the game of cricket. And so we thought like, this might be a good tool to get the entire like, community together, teach them something new. And it's a physical, again, physical activity, so it goes very well with the theme of the social well-being. And so that's where, we started planning on this event. There were like a lot of other folks who came in, who joined, and still helping, like, to organize this festival. We actually wanted to call it like festival, cricket festival. But unfortunately, because of the COVID, again, the cases rising, we had to postpone it. And we're still looking at the ways. So our idea was not just play the cricket, like a match, but get the community involved. And so we thought, we can do like a clinic, like a coaching clinic, so where we could let the people register, and according to different like age groups they fall in, we can conduct like a cricket clinic. We have a lot of volunteers who were willing to, teach the basics of cricket to kids, adults, whoever is interested. And so that was and then actually, whoever is interested in actually playing a cricket match, we could make like teams and play like a small tournament, everything like, within like a one day, like, a few hours. And so that was the idea. And so because of the COVID situation, we have to drop the festival, the coaching clinic, for now. But we are still thinking of like maybe actually do like an exhibition match where people from Kosciusko County can come and watch this new sport. And maybe if there is enough interest, we could again do these coaching clinics when the time permits. So thank you.
Thank you, Devendra. Okay, I think we're going to move forward with Dr. Kevin Roberts. Kevin is on the Physical Wellbeing Committee. Kevin, can you introduce yourself?
Yeah, I'm Kevin Roberts, Dean of the School of Behavioral Sciences at Grace College. So I became interested or passionate about this, just a long family history of people in healthcare. And I've worked in both mental health, obviously, and healthcare settings. My doctorate's in clinical psychology, actually. So, and even my research has been related to things health related, like people who are struggling with their diabetes or non-compliant. How do we work with folks to help them make lifestyle changes? And what are some things that can be really effective in doing that? So that was really my passion for working in the physical well-being part of it. And, you know, the data that we got back, obviously, from Gallup was very consistent with what we saw, the county health rankings, lots of measures where we saw things like obesity being really high in our county, physical activity, even our produce consumption was low, exercise was a big issue. And then, you know, a lot of these lifestyle choice related things, right? The smoking and exercise. But we're also scored, we struggled in the chronic health conditions. And those chronic health conditions of high blood pressure, cardiovascular disease, and diabetes were particularly high. And so those were kind of some areas that we were starting to notice, as well as we wanted to take a hard look at what are some low-hanging fruit of some things that we could start with as short-term goals.
Perfect. Can you tell us a little bit about the short-term goal of the Physical Wellbeing Committee?
Yeah, so there were kind of 4 areas that we focused on. One, you know, there's a lot of times it's really difficult during these winter months, especially in northern Indiana. You get that lake effect snow coming down from Lake Michigan, and you know, it's just not good for outdoor activities. And there are a lot of difficulty providing free or family-free exercise opportunities. So we really wanted to try to do something along that line. So right now there are 3 possible places that we're trying to increase and have free family activities where people can come and they can exercise and be active and to the benefit of our communities, right? We also had like the Silver Sneakers programs. We wanted to create a resource hub so that the information could get out. That's one of the things that's problematic for us, is being able to communicate to folks where they can go be physically active. So we really wanted to change that. If you've never been to Kosciusko County, it's actually a beautiful county. There we have lots of trails. K21 has been instrumental in allowing us to have trails to ride your bikes all throughout Warsaw, Winona Lake area, as they're butted up against each other. And so we wanted to be able to have videos where people could go to try different trails and to have all these outdoor activities. So you're able to bike all around our area and feel safe while you're doing it. And we're trying to increasingly make that well known and trying to get people to be able to go out and walk those trails and be more physically active, because these are some of our obvious target areas that we really would love to make some ground up in.
And so what do you think that you hope's the outcome of your involvement in this initiative?
Well, I think one of the things we talked about is the need for community-wide strategies. Our group was coming together towards that exercise component, and that's important, but there's a lot of lifestyle direct related issues. Not only just produce consumption, you know, K21 is very instrumental in what some of the things we've done. There's an ice skating rink going into Winona Lake, right down the hill from our college. And so, you know, just wonderful outdoor activities, even in the winter months. But we really wanted to be able to create some community-wide groups, hopefully, with healthcare and mental health care providers, because these are both health-related issues in identifying these patients, but they're also lifestyle choices, right? That ultimately the people have to make. And sometimes our providers have limited time with their patients. And you see our numbers up here, we need to be able to attract more talent, more dental, more physicians to our community. And that means a lot of times our physicians are worked very hard. And consequently, we need to be able to have people who can have these conversations with folks. So we would like to be able to do a better job at addressing some of these lifestyle issues. And what are going to be some of those long-term solutions to some of these problems where we're particularly high at in those chronic health conditions with high blood pressure, diabetes, and cardiovascular disease. We really would love to see a lot of ground made up in those. And of course, that's going to be through those lifestyle choices that folks make.
Great. Thank you, Kevin. I appreciate it. I think next we'll go to the Financial Wellbeing Committee. Alyssa, could you introduce yourself?
Sure, Alyssa Lowe, and as she said, I'm on the Financial Wellbeing Committee. Financial well-being is about effectively managing your economic life, and I think it's important to also include in there the full definition to reduce stress and increase security. You know, a lot of times we stop at economic life when we think of financial well-being. And I don't have this in my notes, but as we began to meet in our own individual committees, and as we begin to present at other conferences and things, we began to realize that all of these committees and areas of well-being interact so much or intertwine so much within each other, you know, and so financial well-being, we talk about reducing stress, and you know, stress causes a lot of physical things, and so it's really neat to see us you know, putting together these projects in the groups and seeing how they all intertwine, and I'm looking forward to seeing some end results once we get further into this. But they asked us why we said yes, and for me personally, for the Financial Wellbeing Committee, I know what it's like to be my basic needs not being met. I was raised in poverty. I know what it's like also to not have my basic needs, not need them to be met. They're all there. And so I just thought I want to be part of the solution of getting people from where I was into where I am now. And so I've said yes. And I laughed at myself because I thought that I got chosen because of who I am. But then I also should mention, I am the Director of Development at Combined Community Services. I guarantee that is why I was chosen to be on the committee. We provide services to low-income families in Kosciusko County. We have a food and clothing pantry. We help out with utility assistance. And we also have a Project Independence and Hand Up program that helps graduate people to economic self-sufficiency, so they're no longer needing government assistance. And so right there, we have a lot of our target audience of what this committee's goals would be. You know, I love Kosciusko County. I live in a great community. I was born and raised here. I think it's amazing. And so I'm very competitive also. And so whenever we look at numbers on these tests and anything that I see on the news, anything, I'm always looking, where's Kosciusko fall? You know, and we are usually, like, if you look at the averages, we're usually above average. And so I was like, yes, we're so good. We're awesome here, right? And then we looked at this Gallup Wellbeing financial report, the financial portion of the questions, and I'm sitting in the first meeting, I'm like, oh yeah, we're above average, that's great. And Lisa and Jerry and some of them were like, you know, I'm you know, not happy about these results, you know, and so I began to get convicted, like, and it was so awesome that our leaders, they weren't satisfied with being average or a little bit above average. They're like, what can we do better? And so it was really contagious. I jumped on board, what can I do better? And now I'm not satisfied with those numbers, just above average. So, but as a committee, we asked ourselves to imagine if Kosciusko County residents had enough money to afford their basic needs and knew how to manage their money well. What would that look like, and how do we get there? And when we talk about finances, people are very private about their finances and embarrassed. I mentioned in a previous meeting, my kids, one daughter in particular, is all about cars. She loves Porsches. And so she points out cars all the time. Mom, they're rich. Look at that car. And I say, yeah, they're either rich or they're extremely in debt. So, you know, you can't just size somebody up by what you see. And so our target audiences that we're looking for A lot of them will be through my combined community services and who we serve here, but some of them, you can't just look at them and point them out. And so that was something that we address in this community. But in asking ourselves, to imagine if everybody had enough to afford their basic needs, man, there were so many projects and so many ideas that came out of that. Like I was almost overwhelmed because it's like, we could do workshops, we can do lunch and learns, we can do this marketing material and get it out. But then we kind of were like, okay, let's take a step back and start at the beginning and do a small project. We need to build an audience. And how do we find this audience? Because we can make all the marketing materials we want, but we need people to want to take them. We can have workshops, all we want, but we need people to want to attend. And so we wanted to create a place where people would be comfortable, be used to engaging, be used to, almost a place of trust. And so locally, we have this Facebook group called To Go Kosciusko, and all the restaurants, people post anything that has to do with food in Warsaw. It was started by the chamber, Rob Parker's from the chamber. And man, it blew up in our town. There's so many members, and it became a place where restaurant owners were like, hey guys, sorry, we have to close early. We don't have enough employees, due to COVID. I know all of you guys are facing that. And so we just saw how engaging it was and how information was being pushed out and more people were joining. And so you unmuted, Lisa. Am I running out of time here?
Yes. We have 5 minutes and we still have to try to get Kathy in.
So long story short, we started a Facebook. We're starting a Facebook group, and we're going to start building our audience. And that's our project. And we hope that we can reach as many people as possible. Thank you.
Thank you, Alyssa. Kathy represents our Community Wellbeing Committee. Kathy, do you want to introduce yourself? And since we only have 5 minutes, just kind of give us a brief overview of what our Community Wellbeing Committee is doing.
Okay, thank you. My name is Kathy Groninger, and I'm originally from Indianapolis, and I came here about 23 or maybe 25 years ago to practice law. And I'm currently not in private practice of law. Instead, I'm self-employed. My husband and I have a real estate development business, and so I'm currently involved in that. But I'm also a member of the county council, and that's probably why I got chosen to be on the committee, was from that perspective. And in that perspective, I'm also on the committee that has to do with safety and security. So our group, we're looking at safety and security, and our question had to do with what would it be like if everyone in Kosciusko County felt safe and secure. And so we're basically looking at various different aspects, and it would be like police, first responders, and then also like, how does the community feel as far as their safety and security? And overall, with regard to our Gallup poll results, we felt like we had pretty good results. Most of the people felt very safe, but there were some minority communities and some groups that didn't have as good of answers as what we would have liked. So we're basically, the reason I said yes is just because of my previous experience in practicing law. I did a lot of criminal law, so I had a lot of experience with police, trying to make this fast because I know we're short. But anyway, I had a lot of experience with police and had a lot of good relationships there. And then also being on the emergency management committee on the council, I'm just really interested in all that. And I just love Kosciusko County. And I just wanted to do whatever I could do to help. But also, I really want the people who maybe don't feel as safe to figure out what we can do to help them feel safe and have this be a place that they really love and want to continue to live here and raise their families here and all that. So that's why I said yes. It's been super exciting. I love working with Lisa and everyone else. It's been very interesting. Our project, basically, we're looking at setting up focus groups to meet with the police departments and also their spouses, police officers, to find out, what we can do to encourage them, because with everything going on with all the defund police movements around the country, overall law enforcement is not feeling, or their morale is basically lower than it has been previously. So we want to definitely encourage them, let them know how much we care about them and support them. But on the other hand, we also want to meet with community leaders within some of the minority groups that don't feel as safe, to meet with them to just, find out, what is it specifically about their situation that makes them not feel safe, and then see if we can come up with some recommendations that we can pass on to our law enforcement officers to put up, have some strategies that will work to help them overall feel safe and love this community like the rest of us do. And then the other thing is we're dealing with the fire departments, first responders. They just have different needs. So we're really kind of all over the place. But anyway, with regard to that, so we've been meeting with them, talking with them, trying to see what we can do to help their situation. And in their situation, it seems that recruitment is their issue. So we're looking at ways that we can help them with the recruitment. So overall, and as far as the other question, I think was, what's our goal?
Yeah, you know what? I'm going to cut you off. Just really sorry, we were out of time.
No, that's okay.
I wanted to at least.
We just want to be successful.
Yes, thank you,
That's our
Kathy.
goal.
Thank you. I want to at least be able to introduce Barb. Barb, can you introduce yourself? Barb is actually on the Career Purpose Wellbeing Committee. Are you with us, Barb?
She's muted.
Oh, Barb, you're muted.
Hello, my name is Barb Ridley, and I'm co-chair on the Career Purpose Wellbeing Committee. And I'm often referred to as a retiree, but it all depends on how you refer, what you think of as a retiree. I'm currently working at an abuse shelter here in Kosciusko County as a shelter advocate, and I do a lot of other volunteer activity in our community.
Great. Can you just tell us a little bit about Antonia? Are we out of time?
It depends how much time you want for questions. So if we use some more time, then we'll just shorten our question time, but I'd love to have Barb have an opportunity to speak. So.
Okay, great. Yes. So Barb, can you tell us a little bit about why you said yes, or just about the project in general? Yeah.
Okay, and I'll try to be brief. I said yes because I enjoy volunteering in my community, and I want to see our residents live well. Our committee helps to design a pilot mentoring coaching program for Kosciusko County residents to use that will help them achieve greater career, purpose, and well-being. And we've already started. We invited our community to share their ideas about what they think would help them have a sense of well-being. And we'll use that information to develop a program that will hopefully increase the number of people in our community who are happy in their career and personal growth in our community.
That's great. That was very good. Okay, Antonio, if you want to open it up for questions.
Absolutely. Thank you all so much. You guys have been wonderful. And if I would love to extend that if there's anything that Hoosier Health and Wellness Alliance can do to assist you in any of your efforts, we are simply an email or a phone call away. Lisa, unfortunately, can't shake me, so she knows how to get a hold of me. With that, I will open it for questions. There is so far one question in the chat. Well, there's a comment. Gina says that her brother-in-law and his family live in Kosciusko County and have hiked several of your community's impressive trails. Their family hikes them every Saturday morning. So kudos to your trails initiatives there. And I posed a question that this was probably 3 panelists ago, but many of you have mentioned the straightforward ask of the committee. And can you share why it's important to outline what the working group or the committee requirements are and how that impacts your decision to join a committee or not?
Yeah, I think that's a great question. And I know that there were, people that we asked whether or not they would like to be involved in the committees. And when we, told them this is what our expectations are, our expectations, are to meet, ever so often and for such a long period of time. And there's expectations that you will actually have to, do work. Everyone on the committee actually takes something away that they have to do, and they have to report back, that next month. And there were some people that just didn't have the time, and they knew that, and they were able to say that right up front. And so that was very helpful.
Any of the other panelists have a comment on how they have chosen to either be on or off of a committee?
I guess I can speak to it. Just my passion for what the committee and the goals were just superseded what the workload was. And so that's why I committed. I was willing to do whatever. But I wanted to mention when we got on the committee, Lisa, I don't know if you got this from Antonia or if you did this yourself, but I know it's a style of holding a meeting, but she began to list all the resources that we have. Okay, what do you have? Oh, you have a room. Oh, you like to speak. Oh, you're good at social media. And I've been involved in a lot of committees, a lot of boards. I sit on 2 boards. I work for nonprofit organizations that have boards. And it was a little backwards from a typical meeting. And I really struggled with it at first, honestly, because I'm like, I'm used to, I work in the ministry and church, and like you find a need and then you meet it. There's no ifs, ands, or buts. And so this was completely backwards, like finding what you can meet and then let's create the need. But you know, I guess I was open, maybe on the inside, but I was open to it, and it was very, very neat process. And I think it is becoming more effective, which I know is the goal for that style of holding a meeting. So I don't know if you got that from Antonia or you know, when you spoke about her earlier, but that's
all Lisa.
great.
That's all.
Okay,
Lisa.
good job, Lisa.
So that specifically comes from strategic doing. And so it's a different way of thinking about things, because oftentimes we kind of get stuck in, well, what don't we have? What resources do we not have? And so just to begin a conversation about, let's go around and let's talk about all of the resources that we do have. And, you know, sometimes people, you know, are like, oh yeah, I didn't realize that we had that. And so, yeah, it was
somebody
different.
mentioned it earlier, I think it was Antonia, like sometimes we have all these meetings and they're not very productive, you know, and so that forces you to be productive. So I recommend anybody who's holding meetings to try that format out, because it was really different for me, but I liked it.
I would say for me,
Something to add?
yeah, I just wanted to say I was intrigued by the whole idea of strategic doing. I thought, wow, that just really sounds interesting. And I've never been in a meeting where we're doing, quote, strategic doing. And I thought, well, I like to learn. So I'm like, this will be really interesting. And I really like the idea that, like, especially in our first few meetings, how we assign different tasks to people. So you didn't have one person doing everything. And you just felt like as a group, it really was a collaboration, and we all had different points of views and different perspectives. And I just thought it was really neat. So anyway, I wanted to learn. That was part of it too. And I'm learning.
That's wonderful. And I love the shared accountability, because when everybody has a task to leave with, then you can, you know, if Alyssa doesn't follow through with her task, you'll be like, hey, where are you on that? And it kind of gives, sorry, you're on my screen. I'm not saying you haven't followed up with a task, Alyssa. You're just picking on you because I can see you.
I have.
But you can
Well, also, if you don't get
so.
your task completed, then you're like, oh, darn, I failed on my task. Or, you know, you tried, but you didn't actually, I mean, you gave it your best shot, but you didn't get the results that you wanted. But still, you come in and you report, okay, this is what I did, and it didn't work out so well, but you still learn through that. So it was really good.
Patty Rose says Purdue Healthcare Advisors will be hosting a strategic doing workshop and getting certified to be a strategic doer in the near future. If anyone is interested in getting certified, please reach out to Patty Rose. Patty, can you drop your email in the chat for Lisa, and she can send it out to her working groups, please?
And that's exactly what I did. I went through the process, a 2-day workshop with strategic doing. So
that's wonderful. Thank you, Patty. Any other questions? We're at the 2-minute mark. Okay, I'm going to drop into the chat our final link for the afternoon, where we will have closing remarks by Dr. Sarah Weehee. This has been a wonderful session. Kudos to your entire coalition. Great work, Lisa. This is great. I can't wait to hear more updates, and thank you for being a part of the Hoosier Health and Wellness Alliance. And again, if there's anything that we can do to assist, just let us know. And I look forward to seeing how many strategic doers you have. Everybody goes through the certification. So you guys will be like the strategy king and queens of the state. So wonderful. Okay, please follow the link and we will see you back in the main session. Goodbye, everyone.
Bye.